Measles, a disease the United States officially eliminated in the year 2000, is now making a serious comeback in 2026. For many people, measles feels like a disease from the past, something our grandparents dealt with. But today, outbreaks are happening again across multiple states. So what changed? Why is this highly preventable disease spreading again? And most importantly, how can families protect themselves? In this video, I'll break it down clearly, using facts, not fear. Measles is one of the most contagious viruses known to medicine. It spreads through the air when an infected person coughs, sneezes, or even breathes. The virus can stay in the air for up to 2 hours after that person leaves the room. If someone with measles enters a space where people are not immune, up to 9 out of 10 unvaccinated individuals can become infected. That's how powerful this virus is. Measles usually starts like a severe cold, high fever, cough, runny nose, and red watery eyes. After a few days, a red rash appears, usually starting on the face and spreading downward to the rest of the body. But measles is not just a rash illness. It can cause serious complications. Complications can include pneumonia, ear infections that may cause hearing loss, and in severe cases, brain swelling known as encephalitis. Young children, pregnant women, and people with weak immune systems are at highest risk. Before vaccines, measles caused hundreds of deaths in the U.S. every year. Yes, measles was declared eliminated in the United States in 2000. But eliminated does not mean gone forever. It simply means there was no continuous local transmission. Measles still exists in many parts of the world, and because we live in a global society with travel, the virus can be imported at any time. So why is measles returning in 2026? The biggest reason is declining vaccination coverage. For measles to stay under control, about 95% of the community needs to be vaccinated. This is called herd immunity. In recent years, vaccination rates in some states have dropped below that level. That creates immunity gaps, and measles spreads fast in those pockets. The MMR vaccine, measles, mumps, rubella, has been used for decades. 2 doses provide about 97% protection. It is one of the most studied vaccines in medical history. The majority of recent measles cases in the U.S. are occurring in unvaccinated individuals or those with unknown vaccination status. This is not coincidence. Here's how outbreaks usually start. Someone travels internationally, gets infected, returns to the U.S., and enters a community where vaccination coverage is low. Because measles spreads so easily, it can move rapidly through schools, daycare centers, and social gatherings. Within weeks, dozens of cases can appear. Another factor is misinformation. Social media has amplified vaccine myths, creating confusion and fear among parents. When vaccination rates decline even slightly, measles takes advantage of that gap. Viruses do not respond to opinions. They respond to immunity levels. Infants under 12 months cannot yet receive the full vaccine schedule. They rely on community immunity for protection. If vaccination rates drop, these vulnerable children become exposed. This is why measles outbreaks are not just individual decisions. They affect the whole community. Prevention is straightforward. Ensure children receive both doses of the MMR vaccine. Adults unsure of their immunity can consult their healthcare provider. If traveling internationally, check measles advisories. And during outbreaks, follow local public health recommendations carefully. Measles is not returning because medicine failed. It is returning because immunity levels dropped. The tools to stop measles already exist. The question is whether we use them. If you found this video helpful, share it with someone who has children or is planning to travel. Accurate information saves lives. Stay informed, stay protected.